My name is Myra Stephen, and I am the middle daughter of Marcia Stephen. My mom spent about 2 weeks at O'Reilly Soldiers Memorial Hospital last summer. She was admitted on July 6th, moved to hospice on July 21st, and she died on July 22nd. As a family, we appreciated the care my mother received. We were generally treated with kindness and respect by busy doctors, nurses, PSWs, and other staff. While overall our experience was a positive one, we also had some experiences that I think bear examination on a policy and an implementation level. My mom had Alzheimer's disease. My sisters and I, together with some amazing private caregivers, public health care supports, and community organizations, had been supporting her to live in her home. She was at the stage of her disease where she needed support 24/7. When it was my turn to be on with my mom, I never left her alone, so I couldn't imagine leaving her when she was in the hospital. I stayed overnight with her first night in Emerge, and then when she got moved to Soldiers 1, I was asked to leave at the end of visiting hours. The nurse and the nursing manager informed me that family members were only allowed to stay if the patient was palliative or if there was a language barrier. With my mom's condition of Alzheimer's, a palliative disease, she had a language barrier. If she was told to use the call bell to call for help, she wouldn't have been able to remember. We didn't want her waking up alone, confused, and scared. Ultimately, when I received permission to stay, the nurse brought me a comfortable chair and a warm blanket, and I truly appreciated that gesture. I spoke to my mom's doctor in the morning and asked that it be written into the orders that a family member could stay overnight. But I wondered about other families who, in similar situations, may have just left when they were told they had to go. While waiting for the decision about whether I could stay, I found a research study about the impact of families on patient care and a policy paper for the Ontario Hospital Association and the Change Foundation about the value of family presence and open visiting policies. Both got me thinking about family-centered care and what that really looks like in practice. The research paper said loved ones are not visitors in a patient's life. And the policy paper said healthcare professionals and families all have important roles to play in supporting care. This is something most would agree with. And I think it really bears thinking about what does that really look like in practice and how do you embed that into the hospital culture? I appreciate the challenges that hospitals and the healthcare system are facing with resource and staffing pressures. And with COVID and other infectious diseases more prevalent, the challenge of infection prevention and control. I think putting more attention on patient and family-centered care can be part of the solution. Before my mom went into the hospital, working closely with my sisters, I was the point person for her care, making connections between doctors, nurses, agencies, public and private healthcare, all with my mom's needs, strengths, interests, and wishes at the center. I came into the hospital with my mom with the knowledge of her current health needs and also what made her laugh, what made her happy, and what brought her comfort. Think about what an asset that kind of knowledge is to patient health and well-being. I understand that Soldiers had an open visiting policy before COVID, and there isn't consideration of going back to that now because of infection prevention and control. But I hope you will consider looking at both visiting policies and other measures to recognize the impact of families and friends on patient health and well-being. What if, as a part of regular intake procedures, one of the steps was that staff provide a quick orientation to a family member about how to be helpful? For example, how best to communicate with nursing staff, where to access water and other basics for the patients, when to give staff space. To better understand the patient as a part of intake, ask the patient or their family member to describe what a typical day looked like before they entered the hospital. Ask what the patient enjoys. I understand that every family and every patient is unique and also how busy staff are, but I believe that small changes can be made which recognize family members and patients themselves as a critical part of the healthcare team. On my mom's last day at Soldiers, a student nurse was assigned to my mom. Her name was Georgina. She talked to us and asked us what my mom liked. My mom was mostly unresponsive at that point, but my sisters and I told her that our mother was a teacher and a reader. She loved art, she loved music, and she played the piano. She was really smart, she had a great sense of humor, and she had lots of energy. Georgina and her colleague gave my mom the most thorough and careful wash she'd received the whole time she'd been in the hospital. And then Georgina held my mom's hand and sang her a song. That meant so much to all of us. I truly hope that as Georgina gets busy with her job of full-time nursing, she is able to hold on to those important practices of taking time to connect, listen, and really respond with care that is personal to the person that she's looking after. Her attention to the physical, social, and emotional well-being of both my mom and us as a family really made a difference. If I can help with any steps that Soldiers is continuing to take to improve patient and family care, I would be happy to.
Hello, everybody. I'm Christina Clayton, and I'm the manager of patient experience. And I was able to connect with Myra a little bit before this filming of the video. And really, her story and her family's story helps us to highlight the importance of our essential care partner program. And it really highlights that we need to do a better job about communicating this program. So this was something we put in place during COVID to help support patients and families in their care. But this highlights when she wasn't even offered this program that we have some work to do in terms of how we communicate this program. We really need to do a widespread communication plan internally to really highlight the importance of the program with staff, and so that they're offering this to caregivers when they need to, when they feel they need to stay longer hours or when they really want to partner in care. As well as we need to do some external communication with the community. So we've reached out to some of our PFAC members to look at the best ways to do that, as well, so that everybody in the community knows to ask about the program as well.